I'm Clint Cary. I'm a urologist here at IU Health. I specialize in urologic cancers, and I've been in practice here since 2013. So why did I become a doctor is not the typical answer that a lot of physicians will say where they realize this at the age of 5 years old. For me, it was more of a process of understanding that I enjoyed science, and as I went along that process in college with more coursework, coupling that with some volunteer work at one of the local hospitals, those two things just kind of came natural and kind of increased my interest in the field, and so that led me into my current career, which has been very good for me. And why specifically for urology? I feel that that has offered me a good balance of clinic patients and getting to know patients over the long run of their clinical care, but also doing a variety of surgical procedures. And all that has been a big influence on me in my career. So at the first appointment, a lot of my patients that I see are coming for some type of cancer operation, and so I try to sit down and understand everything that the patient has already gone through and talk them through what they can expect with their upcoming surgery, because I feel that's important to understand. You know, when you're going through difficult situations, you want to have as much information about that as possible. And so I try to take the time to help them understand what it's going to be like before surgery, while they're in the hospital, and when they are recovering back at home, because I think that is helpful, and I think patients appreciate having as much knowledge as possible. So a couple things that I love about my job is the association with the IU School of Medicine. Being involved with bright and intelligent residents and fellows really continues to push us to be on the cutting edge as far as our clinical treatments and our medical research. So it always makes us strive to improve ourselves. But at the end of the day, it's about patient care, and so it's really enjoyable to see a patient back after a surgery that they've made it through and they're on the better side of things. And to be involved in that experience is a great opportunity and something that I'm very appreciative of. So in my free time outside the hospital, I have three great children who keep us quite busy. My wonderful wife, we enjoy spending time together as a family, and that's something that's important to us. And so that family is something that we try to take a lot of time for outside the walls of the hospital. Growing up, I played a lot of sports, and so that's been a big enjoyment in trying to get our kids into sports and be involved with them. And so all of those things are stress relievers outside the hospital, and certainly something that is quite enjoyable for me.